Hello, I am Dr. Ahilasamy from Chennai. I am going to show a case of septoplasty. I will be showing the septal flap elevations. The case being done under local anesthesia. It's a 45-year-old male with a gross septal deviation to the left side. The first step is to pack the nasal cavity. You can see gross septal deviation to the left side. I am packing with a roller gauze soaked in a solution of 4% lignocaine and adrenaline. The ratio 1:1 into the crevices before I am giving the spinobeltin block. So repeatedly pack the crevices and the nasal cavity with a pack without traumatizing the septal or terminate mucosa, which is very important. This step will be done on both the sides repeatedly for few minutes. Now I am giving the spinobeltin block on the left side with the 23 gauge spinal needle with a solution of ropivacaine 0.5% with adrenaline. That is 20 ml of 0.5% ropivacaine along with 15 drops of adrenaline. Sometimes in cardiac patients I reduce to 10 drops of adrenaline. The same step is repeated on the right side, giving the spinobeltin block, which is at the posterior end where the middle terminate curves and attaches laterally. Now I am giving the infiltration for the septum on both the sides for hydro elevation. Being done under local anesthesia, we don't give hypotensive anesthesia, but this case is done under, usually we do under IV sedation. That is, this case is taken with remifentanil with propofol, but under moderate sedation. Now I am using my monopolar diathermy knife, Dr. Ahila's round diathermy knife. For septum, I have made to a square which is available with Sandoz Surgicals of Mumbai. Either you can use the round rosen shaped knife or the square knife to make a incision so that the incision site will not bleed and it will not fog the scope frequently. Then I make the incision again with a 15 blade knife. Now with a small cartilage elevator, I am elevating the flap. Note where you have to start elevating and how I do. This is the one place I am using the suction. Hardly any bleeding. This is the beauty of the doing surgeries under local anesthesia. And patients are very comfortable with a good but moderate IV sedation. Sometimes I use dexmedetomidine with fentanyl. Here I am using remifentanil with propofol, always with the anesthetist help. You can see RBC is running. Now the cartilage is not fully cut, so I am making incision to go to the right side to elevate the flap. Again note how, where and I get a plane all within seconds, and it's almost an unedited video. You see hardly any bleeding. Very minimally edited video. When the field is so clear like that, you will not produce complications and your surgery will be fast. Patient post-operative healing will be very good. You don't tear the flaps. Now I am dislocating the bony cartilaginous junction and remove the deviated part of the septum, as well as I will remove the spur. So I am using a black sleeve to take it out. So there's a spur, cartilaginous spur in the floor. Some more elevation of the flap in the floor. Now I am using the gouge without mallet, taking the spur with wrist pressure itself. Very good septal correction. You can appreciate the full middle turbinate, then the choana also, and hardly any septal tear, flap tear. That's the other side. You can see up middle turbinate and everything. I combined a post-nasal neurectomy also in this case, which I am not showing in this video. Finally, we put a quilting stitch with a 3O chromic cutting needle to keep the flaps intact, because we don't pack the nasal cavity after any septoplasty or any fess or sinus surgeries. And morning we operate, we discharge the patient in the evening as daycare under local anesthesia with a moderate IV sedation. This quilting stitch will keep the flaps together so that there will not be any hematoma formation. Thank you for watching, and see you in another beautiful video soon. And you can contact me at the following email and other phone number anytime.